Good afternoon, James.
Yes. Looking forward to chatting with you today. We've got the good doctor joining us here on our big broadcast. Now, doctor, give us a little bit on your background so the listeners have a little bit of an education on where you're coming from on the topic today.
Well, I'm an oral pathologist, many years experience, and I've been conducting tobacco research for the past 22 years. I've published in most major medical journals, and I'm currently on staff at the James Graham Brown Cancer Center at the University of Louisville in Kentucky.
Wow. Now, tell us a little bit about the topic today, my friend.
Well, we're talking about smokeless tobacco and pancreatic cancer, a bad cancer that unfortunately strikes a few thousand Americans every year. It turns out that the Swedes have conducted some research, and pancreatic cancer is not elevated in Swedish snus users. And that confirms previous studies about smokeless tobacco here in the States and pancreatic cancer. So we don't have any association or risk, which is very good news.
Now, doctor, tell us a little bit about a little bit more details here on the good news on this, because this is some amazing news.
Well, what happened is the federal government websites from the FDA, the CDC, and the National Institutes of Health have all claimed in the past that smokeless tobacco causes pancreatic cancer.
Yep.
They don't provide any evidence, but now we have numerous studies, large studies, that document that risk is not present. So it's time for the federal government to change their websites and stop making claims that don't have any evidence.
Ah, okay. Now, how do we get this to happen? How do we get folks to kind of get together and wake up on this whole thing?
Well, Americans who use chew or dip or snus need to start contacting government officials and telling them to start telling the truth about smokeless tobacco products. No tobacco product is perfectly safe. Well, no human activity is perfectly safe.
Yes.
But smokeless tobacco products and e-cigarettes are vastly safer than smoking. In fact, we can't even measure the health effects with any precision because the risks are so low. And so now we have to start telling the truth, and we have to get government to start telling the truth so smokers have options about safer products.
Fantastic. We've got a great guest with us today, Dr. Brad Rodu, and he joins us live here on Skype audio to discuss this new study that has recently taken place, and it reveals that snus and does not increase risk for basically pancreatic cancer. What is smokeless tobacco, and give us some details on this so folks are aware of what we're talking about here.
Well, most Americans know smokeless tobacco as moist snuff, also called dipping tobacco or dip, chewing tobacco, which comes in foil pouches. That's the stuff the baseball players generally use. And then snus, which is a Swedish moist snuff product that is starting to become common in the United States. All of these products can be tucked inside the lip, and they can be used invisibly. especially if you use it in your upper lip. You don't have to spit. And these products are great options for someone who wants to have tobacco and nicotine enjoyment without the high risks that burning tobacco and inhaling smoke is. So that's why we have to get the word out that these options are great substitutes.
Now, this study that recently took place, we've got the good doctor with us today. Snus does not lead to increased risk for pancreatic cancer, according to a study that was published recently in a highly respected international journal for cancer. Give us your take on this.
Well, this study was from several universities all throughout Sweden, including the Karolinska Institute, which is one of Sweden's most prestigious medical centers. Basically, these investigators came together. They collected several 100,000 people, men mostly, who use snus, and then they looked at what their risks are. And they've published a series of studies looking at several diseases. And so far, they've basically come up blank with respect to any potential risks from snus use. It's great information because Sweden represents one of the world's most extensive smokeless tobacco usage rates. Many, many men in Sweden use snus and don't smoke. And that's one of the reasons that Swedish men have among the highest life expectancy in the entire world.
Fantastic, fantastic. We've got a great guest with us today. He joins us live here on Build, Grow, and Enjoy. The fantastic Dr. Brad joins us here on our big program. Now, snus is the safest, cleanest, most discreet form of tobacco around. Many people have had great success quitting cigarettes and dip with it. It doesn't cause oral cancer, gum disease. Give us a little bit of details on this.
Well, there are numerous studies about all of those problems, and snus has passed the bill with respect to mouth cancer, pancreatic cancer, heart disease, stroke, all of the problems we normally associate with smoking have little or no risk when it comes to snus use. So, snus delivers nicotine, but nicotine, like caffeine, doesn't cause any disease. So we consume our coffee and cola drinks and tea, we get caffeine, we consume them in a relatively safe way. That's how the Swedes consume snus and nicotine. They get it in a form or a delivery system that's not dangerous.
That's very interesting. We've got a great guest with us today. Dr. Brad Rodu joins us. Now, this study is very interesting. Can you give us a little bit more details on this?
Well, the study was from people who use snus throughout Sweden. And so we have a wide distribution of snus users, and they don't show any risks for pancreatic cancer in this study.
Very interesting stuff. We've got a great guest with us today, joins us live here in our broadcast. Now, a lot of people say that smokeless tobacco could be healthier than regular tobacco. What are your thoughts on this, Doctor?
Well, there's no question about it. Smokeless tobacco is vastly safer than smoking. You take smokers, they have risks for emphysema, heart disease, many different cancers. Essentially, when you burn tobacco, you create thousands of toxic agents that you inhale along with that nicotine and smoke. With smokeless tobacco use, there's none of that, those toxic chemicals from smoke. Smokeless tobacco, while not perfectly safe, is so safe that we can't even measure the risks with any precision.
That's interesting. That's interesting. Now, Dr. Brad Rodu is with us today, professor of medicine at the University of Louisville, where he holds an endowed chair in tobacco harm reduction research. Now, over the years, what's been some of the different things that you've done research on in regards to tobacco and some of the different things out there?
Well, we've done research on a number of different aspects involving smokeless tobacco and e-cigarettes. For example, several years ago, we were the first to document that men in the United States have switched from smoking to smokeless tobacco use. They've used dip and chew products to become smoke-free and lower their risks. We've conducted a whole series of studies showing how smokeless tobacco users have much higher life expectancy than smokers. In fact, smokeless tobacco users live basically as long as non-users of tobacco. I've been conducting research for 22 years and publishing it in high-quality medical journals.
We've got a great guest with us today. He joins us live here on our big broadcast, coast to coast, border to border, build, grow, and enjoy. And a great guest with us today. A new study reveals that snus does not increase risk for pancreatic cancer. And Dr. Brad Rodu, a professor of medicine at the University of Louisville, has made himself available today to talk to us about this study. How many adult smokers try to quit every year and fail, Dr. Brad?
Well, we don't know exact numbers, but we do know that many smokers try to quit and they're not successful. You know, the government keeps on talking about safe and effective quit smoking methods. The problem is those include medicines and nicotine patches and gum. The problem is those products don't work. Population studies show that less than 10% of smokers are successful in any given year. We need to actually improve those success rates so that smokers can get away from smoke.
Well, doctor, it seems that there is a lot of folks are trying to quit. They're using some of these e-cigarettes and some of these different things to quit. What are some kinds of smokeless tobaccos that are out there that folks can use that are safe that you can recommend?
Well, many of the smokeless tobacco products like dip, chew, and snus are available in the same stores where smokers buy cigarettes. They can go ask the clerk for a smokeless tobacco product, many of which come in small tea bag-like pouches that can be tucked inside the lip and used invisibly. So they can find these products. I don't have any interest in commercial tobacco companies.
Yeah.
So I'm not going to talk about specific brands.
No, I was just kind of wanting an overall there, my friend.
Sure, and I encourage smokers to try different products because just like every other consumer product, smokeless tobaccos have different flavors, different tastes, and they work for different smokers.
We've got a great guest with us today. He joins us here on Build, Grow, and Enjoy. Dr. Brad is with us discussing this new study that reveals that snus does not increase risk for pancreatic cancer. What is the Swedish experience? How does this connect with tobacco harm reduction, Dr. Brad?
Well, the Swedish experience is fascinating. Back in the mid-1990s, when I started to do tobacco research, I discovered that the lung cancer rates in Sweden were the lowest of any country in the developed world. Now, it turns out, and most people know this, lung cancer is the sentinel disease of smoking. So you can tell how much a society smokes by what their lung cancer rates are. And when I found that Sweden has incredibly low lung cancer rates, I knew I had to get there and figure out why. So I took a research sabbatical about 15 years ago in Sweden, and I conducted a series of research studies showing that the reason Swedes don't smoke is that they use snus. And that substitution has resulted in very, very low smoking and disease rates. And so that's become the Swedish experience, or as I like to say, the Swedish miracle.
Amazing, amazing stuff. Dr. Brad joins us here on our big broadcast. Coast to coast, to border, it's build, grow, and enjoy. Dr. Brad, as we go, where can people go for more information online or get in touch with you?
Well, they can see my work at Rodu Tobacco Truth. That's my blog. That has access to my book, For Smokers Only, which is available at Kindle and Amazon and iTunes in audio form and in electronic form and as a hard copy book. But Tobacco Truth, we conducted the first ever community quit smoking program in Owensboro, Kentucky, and that's available at switchandquitowensboro.com. And then the book is also has its own website, For Smokers Only.
Good stuff. Well, I appreciate it, sir, and we will talk to you soon. Thanks for joining us today.
Thanks for the discussion.
Definitely. Thank you, Dr. Brad.